On today's episode of the Transplant Helper, receiving better care through better communication skills with your transplant providers. Stay tuned. Well, hey folks, one more time, I appreciate you being with me today on the Transplant Helper podcast / YouTube video series. My name is Jim Merle, and today's topic of discussion has to do with receiving better care through better communication skills with your doctors, your transplant coordinators, your entire transplant team. And I think this information is going to help you a lot. But let me say in the onset, unless you know your body, and we've already talked about that on one of the quick tips, which I'll try to link around this video, unless you know your body, you're not going to be able to apply what we discussed today. So maybe you need to pause the video, go over and watch that quick tip, know your body, or you can watch it at the end nonetheless, but you need to know your body. I just want to point that out in the beginning. Now, on into our discussion. I'm going to use what happened to me on last week as an example of how we can better communicate with our doctors, our nurses, our coordinators, our pharmacists, and all that are involved in our healthcare team in order to receive better care. Now, what happened to me on last week is it was time for my 4-year, and that is an annual checkup, but the 4-year mark was accomplished post-transplant. So I went in for all the typical battery of tests that associate with a heart transplant anyway, which are basically blood work, x-rays, echocardiograms, EKGs, heart cath, and or biopsies. And of course, all that is done and compiled together over the course of a day or so. And then by the very next day, the second day, you go in and sit down with your doctors and your coordinators and you discuss the results of those tests, as well as they ask you how you're doing. Now, it's the point where they ask you how you're doing that is so important. If you're not willing to tell them how you're doing, then I'm going to say in the onset, your communication skills are not good enough. They need to know how you feel, if you're having any symptoms, any side effects from medications or whatever it is. They need to know those facts so that they can better manage your care. And in essence, how you deliver that information to them is going to sometimes make a huge difference in your care. So on to my example. Here's what occurred with me on the other day. I think it was on Tuesday of last week. I sat down with my doctors and all those people that were involved, the coordinator especially, and when they asked that key question, how do you feel? Are you having any problem? The first thing I had to be willing to do was to be honest. I needed to be honest, and to be honest in the sense of telling them that something was really going on, that I was really having a problem. You see, I'm living a life in a very successful state. Post-transplant, I've had a great recovery. Things have gone very well. And because of a lot of things that doctors and nurses and all have said about me over the times and bragged about my success story, I've tried to live up to that, sometimes to my own detriment. And seriously, in that, I've sat before them too many times in these types of appointments. And when they ask the questions, how are you doing? Are you having any problems? I just say, oh, no, I'm fine. I feel great. When in the inside, in the back of my mind, I know something's not right. Something is here that they need to know about, and I need to relate that to them, or in this case, communicate that to them so that they can help me out. So too many times I've sat there just to try to look good and to try to look like the best of the best and this great poster child success story that I have not told them the complete truth. So the first key in this is to be honest. The second key in this, in great communication with your physicians, is not only to be honest, but to be aware. And that is like that episode, Knowing Your Body. You have to be aware of what your baselines are, where you typically stand with those baselines, so that when you describe any symptoms or side effects you're having, you can then in turn describe them also what you already know and what you have already in your mind at least, and you're not a doctor, neither am I, but what in your mind at least you've already eliminated so that they can, as we say in the South, cut to the chase and get down to the nitty of the gritty and really find out what's going on in your case. So here's what I had to tell them specifically. I went in and told the doctors, coordinators on last week, when asked that question, how are you doing, having any problems? I said, look, to be honest, yes, I'm having problems. And the problems I'm having surround some double vision, some blurry vision, some dizziness, some lightheadedness, some weakness at times in my arms, whatever. I listed those things out. But the key to what I did that day was that I was not willing to stop there. Because you see, if you name off symptoms like that and just stop, their immediate reaction, and I'm not knocking them for this reaction, would be to turn back to me and say, well, we might want to check your heart out really good, except for the fact they had already done that the day before. Or their secondary reaction, this is probably the most common reaction to any symptoms that you give a doctor, is, especially in our condition as transplant patients, that may be a medication. Sounds to me like you're having some side effects. It sounds to me like, and I'm speaking as if I'm one of those doctors, like these side effects that you're having or these symptoms that you're having are just side effects to medications. Maybe it's causing your blurry vision, your double vision, your lightheadedness, your dizziness, your fatigue, weakness, whatever it is. Maybe that's what's going on. But see, I knew that wasn't the case. The reason I understand or would assume that's not the case is, like many of you as transplant patients, I've been on the same medications now for 4 years. And most of those medications, even though the dosages have come down, I've been pretty stable in my dosage for about a year and a half or so, or maybe a little bit longer than that. That is, I've been taking the same thing every day at the same time now for a year and a half to 2 years. So I don't suspect in my mind that that's going to be the problem. The second thing they might accuse upon you is that, maybe this is just something that you need to check out. They may ask, when is this happening? Well, that's where my communication skills, I think, came in. I hope that yours will too. Before I ever told them, or as soon as I told them, I should say, I'm having the double vision, the lightheadedness, the blurry vision, the dizzy spells, and such as that, I then turned and told them, without letting them say anything, and I wasn't rude about it, but without letting them say anything, I said, I've already checked. It's not my blood pressure. You see, they could accuse it would be my blood pressure. Some of these symptoms can be blood pressure related, but I said it's not my blood pressure. Every time this has happened so far, I've checked my blood pressure, and for me and my body, it's completely normal. Number two, I said it's not my heart rate. I'm a transplant patient. They might assume that. I said my heart rate's not up. It's not down. It's just setting at average when this happens. Number three, I said it's not my blood sugar. I had checked my blood sugar numerous times. Me, in the beginning, supposing that's what this was. It's not my blood sugar causing these problems. And so I needed them to know that already, because what's the use in them saying, well, we need to do several different tests concerning your blood pressure, or we need to put a heart monitor on you, or we need to send you off for a blood sugar check and for a blood panel to see what's going on there, when I already knew through my knowing of my body and through my applying the things that I know and using my blood pressure cuff and my blood sugar tester and feeling of my pulse at home. I already knew that was not likely the issue. So I told them about that. And I think that makes a tremendous difference. When you go into the doctor and you're willing to be honest with them and tell them what's going on and when it's going on, but then at the same time be aware of your body and already know up front what your body is supposed to be like, what your baseline is, how do you normally feel, what's normal as far as all of those vital signs. And then in the third place, as I'm already illustrating, being clear with them that this is what I have decided maybe is going on. Now, you're not trying to take their place as a doctor, and please don't misunderstand me in that. You're just trying to assist them. On the other side of that, if someone goes in and the doctor say, how are you doing? And you say, well, I ain't feeling too good. What are they supposed to do with that? Or someone says, well, I've been feeling kind of tired lately. What are they supposed to do with that? I think that's what's wrong many times in the healthcare world. Not always, but many times we blame especially our primary care physicians, because we've gone in and given them no information, but we expect an accurate diagnosis. And we don't want to be diagnosed with what everybody else has got, the crud or the common cold or the flu. We want to know exactly what we have, but maybe we're not communicating that well. So you have to be open or honest. You have to be, in that case, aware of your body, and then you have to be clear. You have to be clear as to what your symptoms are, and therefore what you have, if possible, already eliminated as you have taken view of those symptoms. And then once that happens, here's the fourth part of this, you have to be compliant. You have to be compliant, and that is that you've got to listen to what they say now. Now it's time for Jim to shut his mouth, close his lips, and then listen to what they have to say. I've already given my opinion. I've thrown in my 2 cents, as we say. Now, what do they have to say about that? That's where I had to get. Now, these are just kind of the pattern of communication skills that I've used that helped me out. Let me tell you how this worked out the other day. By me telling them I'm having some double vision, some lightheadedness, some blurry vision, some weak spells, and on as that. And then telling them I know it is not my heart rate. I know it is not my blood pressure. I know it is not my blood sugar. I know it is not this and this and that. So they immediately, I got their attention. And immediately they said to me, Jim, I think it'd be better if we scheduled you a CT scan right now. And as I've said before, transplant patients get the greatest of health care. We get priority many times over everybody else. And if you're someone waiting on a CT scan and can't get in, I'm sorry. But before I ever left that room, someone had walked through the door and said, Mr. Merle, they're waiting on you in CT right now. Now, in essence, and eventually, I didn't actually have a CT scan that day because before that even got done, the doctor said, no, hold up, don't do a CT scan. Let's do an MRI with and without contrast, and let's see what we see there, because they're worried about my brain now. They're worried about the potential for brain tumors, for I don't know if aneurysms will fall in, but they had a list of things, which I won't really share, which were pretty scary. And they said, these are the things that could be causing this problem. And we can eliminate this part of things by doing an MRI. I'd already eliminated all the basics myself and saved myself and them a lot of time, I guess. But now they're doing the MRI with and without contrast to eliminate some more things. In addition to that, they sent me to an ophthalmologist to have my eyes checked. They did additional and very specific blood work to check for certain things that were going on. Not that they had noticed already, but to check additional blood work to see what was going on. Again, they gave me the greatest level of care. So in a nutshell, what are we talking about? We're talking about being open and honest. We're talking about being aware of our bodies. We're talking about being clear as to what we need, but then we're talking about being compliant. After I go in with my complaints, I can't turn around and say, oh, I don't want to go to the neurologist. I hate having MRIs, or I don't need glasses. Why do I need to go to an eye doctor? No. Have to be compliant. In everything in the transplant life, you must be compliant. This is no different. So basically all I'm telling you is have great communication skills, and you can improve on that by going into those offices not only armed with your problems, your struggles, your complaints, your symptoms if you're having them, but then in turn give them as much information as you can as to what you've already kind of tested and tried, and help them to get to your care quicker and get a better response. I think you'll get their attention, and I know in the end of things will work out better if you do that. Now, I know this has been very practical advice. I don't intend any of these programs to be anything but practical advice. Again, I'm just someone who's living, having been there, and I'm currently doing that as a transplant patient. So I can only advise you from that perspective, but I appreciate the opportunity to get to do that today. Now, if this video at all has helped you, I hope that you'll give it a thumbs up, that you'll like the video. If it hasn't, give it a thumbs down. That's okay too. I'll deal with that. If you have any questions, any comments about these subjects, you can put them right below this video, or you can reach me on Twitter at transplant_help, or if you'd like, go to my website, thetransplanthelper.com. That's thetransplanthelper.com, and click on the contact button. I'll be more than happy to communicate with you in that way. But maybe these things have helped you. If they had, again, like, share, and subscribe. And by the way, any videos I've linked to around this video, whether it be up in the corners, over to the side, or down below it, they're not always my videos, but I've linked those videos for a specific purpose, and that's to help you to live a better life as transplant. So you're already on YouTube. Keep clicking, and until next time, stay stronger, friends.